Hello friends, today we can learning medicinal botany or medicinal plants and their importance of the medicinal plants or medicinal botany in the modern age. So how it is derived from the ancient, how it is used in modern medicine, how comparison traditional medicine with more allopathic medicine. So we can learn everything from the details about the medicinal plants based on the free history and present scenario. So please like and subscribe my channel further. So medicine botany is a branch of the botany. What is the botany means? It is the identification, nomenclature and classification of the botany is the main importance. Identification, nomenclature, classification dealing with the botany of the plants. So in addition we can add the properties of medicinal properties of the plants, that is the medicinal plants. So that's identification, nomenclature and classification and medicinal properties of the particular plant. After that we can add to identify the phytochemicals and secondary metabolizers a particular plant from the a particular stem, root or flower or fruit or seeds, or whole plants. We can identification a particular compounds in particular plants, so that the knowledge of the plants and the therapeutic agents is the oldest diseases, which is in turn as ancient as a man himself. Though no authentic records of the medicines used by the primitive man is available, Veda, especially Rigveda, is oldest book in the library of the man, supplies curious information of the subject. From that we learn that Indo-Aryan used. So soma is a medicinal agent. So soma plant possesses intoxicating properties, and Vedic Ayurveda recognized as a figure of intellect. The beverage of it is described that it is a inspire joy, it is a driven, it is a purifies, it is given the health and immortality. So that this plant has not yet been satisfactorily recognized and identified, but according to the Dr. Atkinson's, the soma must be the epitra species. So that the word Aushadhi literally means heat produce, a reference of that stimulate the beverage of a soma plant, which literally was used by the Indo-Aryans as a therapeutic agents. The use of the herbs in the treating of ailments began, and now means of the Aushadhi cover all plants exhibit medicinal properties. The knowledge of the plant medicinal plants got accumulated by the primitive or prehistorical society in the curious of many centuries. It is it is greatly to the credit of the people of India that there are acquired aim to with the far large number of medicinal plants that the negative of any other country on the face of the earth. Much of the knowledge of the plant processed by the ancestors has become a lot of the world due to their ignorance of the arts of the writing. In a primitive man might have the large art of the healing through the injury during the hunting in ancients, and bits of the reptiles, especially snakes, in instantly turn into nature for the relieving. Thus began to the explore of the plants as the agent of the cure. Magic and religion play a large part of the medicine's free history of the man's. Slowly, folk medicine or domestic medicine become the established in the society by use of the plants and animals products. In the later curious of the history, medicinal plants, many indigenous medicine system develop all over the world, and the noteworthy by the feature all the systems is that they use mainly in their drugs. Means here good drug obtained from the variety of the medicinal properties, therapeutic properties from the plants. Thus, in our country, Ayurveda, Siddha, our indigenous medical system, and Unani homeopathy are introduced systems into India, which is served as humanist and their best, are totally based of the vegetable drugs. Thus, from the primitive medicine of the supernatant and superstitious, rationals and medicinal evolved, finding the reason and natural explanation of the diseases, diagnosis and treatment. With the advance of the scientific age, allopathy and modern medicine are slowly replaced to the age-old traditional indigenous system all over the world, effective at the greater extent traditional systems. Synthetic medicine formulated which could be provide quick relief, but the that is drawback of the modern allopathic medicine is side effects, means synergetic actives when we are using one particular disease control, but it is produce another disease in particular mm, man or woman. So that due to the inherent disadvantage of the cost of the drug and the treatment, common men and poor are the most of the effective lot. So the necessity of the above things, the traditional system as alternative modern has become a completely necessity. The major disadvantage of the traditional system in that they are within the reach of the people, particularly in poor, and they climb to the pollution-free, eco-friendly with minimal and no harmful side effects. Even the WHO is giving a considerable importance to alternate medicine system to they provide a primitive health care millions of the peoples in the developing countries. It is the context of the further exploration of medicine has become a very important. In India, Indian materia medica. In India, Indian materia medica, there are more than 22,000 formulation out of less than 200 are the minerals animals origin. The rest of the derived from the vegetable source. The practice of the various Indian systems, especially in the Ayurveda and Siddha in different parts of India, over many years tried to utilize local growth plants and for the possibility and acceptance those which are found useful after the tradition for the treatment of diseases. Medicinal herbs and their derivatives find with a applicable not only in the traditional systems but also modern medicines. Numerous examples can be quotes: opium, cocoa, cinchona, epidra, caffeine, and distalis, and so as podophyllum. Not only few, those active principles are used even today as active therapeutics for some of no subjective are so far found. Many modern pharmaceutical companies are nutraceutical companies are focused to development supplements from the medicinal plants, especially some of the plants are Withania somnifera, hypomia, and other things are used so far. So, exploration of new herbs and large scale cultivation of the knowledge medicines of confirm the medicinal properties is the need for the hours for serving the population, especially developing countries. Economic and Social Commission for the Asia and Pacific regions is CAP is an organization which has an important source of the information of the medicinal plants. The agroclimatic atmosphere is the developing countries make it is possible to grow medicine plants is a emergence. The general demand of the herbal medicine is increasing in spite of the steady supply and synthetic drugs. During the recent time, Regional Center of the Technology Transfer RT, RCTCC, an organization was established to over the exchange of the tech transfer among the member of countries developing world. In the area of medicinal and aromatic plants, the member of the ESCAP are India, Pakistan, Bangladesh, Afghanistan, Burma, China, Philippines, Sri Lanka, Thailand, Nepal. The RCTT conducted the workshop at the Colombo in Sri Lanka, in which is 10 institutes of ESCAP countries joined in the workshop in the field of the medical plant of the tech transfer, and let me more joining. In India, there are two institutes which are dealing with the aromatic and medicinal plant research, CDRA, Central Drug Research Institute, Lucknow, and CMAP, Central Institute of Medicinal and Aromatic Plants in Lucknow.